If you're watching this because you're worried you might have chlamydia, or you've just had a test come back positive, take a breath. Chlamydia is common, treatable, and nothing to be ashamed of. What matters is getting tested, getting treated properly, and protecting your future health. In this video, we're going to cover what chlamydia is, symptoms, and why many women have none, how testing works in the UK, treatment, and what to do about partners, when you can have sex again, and what chlamydia can mean for fertility, including how to reduce risk. This isn't about blame, it's about information you can actually use. Chlamydia is a sexually transmitted infection, or STI, caused by a bacteria called Chlamydia trachomatis. It can infect the cervix, which is the neck of the womb, the urethra, which is where urine comes out, the rectum, and sometimes the throat or eyes. Chlamydia is common, partly because it often causes no symptoms, so people can pass it on without knowing. The good news is, with the right antibiotics, chlamydia is usually cured. Chlamydia is passed through sexual contact, including vaginal sex, anal sex, and less commonly, oral sex. It can also be passed on through sharing sex toys if they aren't cleaned properly, or covered with a new condom between partners. And you don't have to have lots of partners to get chlamydia. One exposure is enough. Also, having chlamydia doesn't mean anyone's unclean or promiscuous. It just means a bacteria has been transmitted. That's it. A lot of women have no symptoms at all, but if symptoms do happen, they can include unusual vaginal discharge, bleeding after sex, bleeding between periods, pain or burning when you wee, lower abdominal or pelvic pain, pain during sex, and rectal pain, discharge, or bleeding if there's rectal infection. And because these symptoms can overlap with things like thrush, BV, UTIs, or hormonal spotting, testing is the only way to know. It's worth getting tested if you've had a new partner. If you've had unprotected sex, even if it was just once, if your partner has tested positive. If you've got symptoms like bleeding after sex or pelvic pain. If you're under 25 and sexually active, because routine screening is recommended in this age group in many UK services. Or if you're planning a pregnancy, or you're worried about fertility and want to rule things out. And if you have pelvic pain, fever, pain during sex, or you feel unwell, you should get assessed promptly, because chlamydia can sometimes lead to pelvic inflammatory disease. In the UK, chlamydia testing is usually simple and non-judgemental. You can get tested through a sexual health clinic, your GP in many areas, some contraception services, and sometimes local online or self-sampling services. Testing is usually done with an NAAT test, which is a very sensitive lab test using a self-taken vaginal swab, which is often the most accurate for women, and/or a urine sample, typically first catch urine. Depending on your sexual practices, they may also offer throat or rectal swabs. And if you're anxious about testing, you can say that. Clinics are used to helping people who feel nervous, and you can ask for step-by-step guidance. This is a really common question. A test may not turn positive immediately after exposure, so if you've had a recent risk, a clinic can advise the right timing for testing and whether you should test now and repeat later. But if you've got symptoms, don't wait. Get assessed. Chlamydia is treated with antibiotics. In the UK, common options include doxycycline, which is often first line and taken over several days, or an alternative antibiotic if doxycycline isn't suitable, for example in pregnancy. It's important to take the antibiotics exactly as prescribed. Finish the full course even if you feel fine. Avoid sex until the treatment window has safely passed. That is not an easy thing to do, as it can take weeks to clear. But let's do it to prevent reinfection and make sure partners are treated too, so you don't get reinfected. A lot of people ask if they need a test to prove it's gone. In some situations, a test of cure is recommended. For example, in pregnancy, if symptoms persist, if taking the treatment properly was difficult, or if a specific antibiotic was used. Your clinic will advise what applies to you. And even if you don't need a test of cure, many services recommend retesting a few months later because reinfection is common. This is the part that worries a lot of women most. Chlamydia can affect fertility if it goes untreated and spreads upwards, causing inflammation in the uterus and fallopian tubes, sometimes as pelvic inflammatory disease, also known as PID. Complications can include scarring of the fallopian tubes, increased risk of ectopic pregnancy, and difficulty conceiving. But here's the key point: most people who are treated promptly do not have fertility problems. The biggest risk is repeated untreated infection or infection that progresses to PID. Signs that may suggest PID include persistent pelvic or lower abdominal pain, pain during sex, fever, abnormal bleeding, and feeling unwell. If you've got those symptoms, don't wait and see. Please get assessed. If you're trying for a baby or planning to, it's reasonable to make sure you and your partner are tested and treated if needed. You can also ask about STI screening if you've got concerns. And you should seek assessment if you have a history of PID, severe pelvic pain, or recurrent infections. If you've had chlamydia before and you're worried, you can speak with your GP about what symptoms would prompt referral, and when fertility investigations are appropriate based on your age and how long you've been trying. Prevention isn't about perfection, it's about reducing risk. What helps is using condoms, especially with new or casual partners. Getting regular STI screening if you're sexually active with new partners. Using a new condom on sex toys, or cleaning them properly between use. Treating both partners if someone tests as positive. And avoiding sex until treatment guidance is complete. You're not expected to be psychic. Testing is the safety net. At your doctor's appointment, you can say, "I'd like a full STI screen including chlamydia. I have symptoms like discharge, bleeding after sex, pelvic pain, or pain when urinating. I've had a new partner or unprotected sex and I want to test. If it's positive, can you advise on partner notification and when it's safe to have sex again? Do I need a test of cure or a retest later? I'm worried about PID and fertility. Can we talk through signs and follow-up?" You deserve clear answers, not judgment. Chlamydia is common and usually easy to treat, but it's worth taking seriously because untreated infection can cause complications. We've talked a lot about PID in this video, so if you want clear details of it, including causes, symptoms, treatment, and how it affects fertility, watch this next.